Headaches during pregnancy can be horrible. Personally, I never really get migraines except for when I'm pregnant, and they're so bad and it's so hard to deal with when you're already sick in other ways, tired, and all the issues that you have in pregnancy. Headaches are so bad. But a lot of women do not want to take Tylenol. If you're wondering why, we have a video that talks about that. And there's a lot of other over-the-counter medication that you simply cannot take, you're not allowed to take during pregnancy. So in this video, we're going to go over natural remedies to manage, reduce, or hopefully get rid of the headaches so that you can try these things during pregnancy and see what helps. I'm Rachel Moises, a mother of 8 from the Mighty Mama movement.
And I'm Heather, a family nurse practitioner and midwife.
So why are headaches so common during pregnancy?
The number one reason is hormonal changes. Your hormones do an absolute flip-flop in order to maintain a pregnancy. And so with that can come a lot of headaches. So many women, for instance, will get headaches with PMS. And those women are going to be pretty prone to more headaches in pregnancy, but everybody is very prone because of that hormonal fluctuation that has to happen to maintain a pregnancy.
Okay. Another factor is dehydration.
Yes.
It's just harder to stay hydrated while you're pregnant.
Exactly.
You need more water, and then plus a lot of times, I know for me, drinking too much water would make me feel sick, or I didn't feel like drinking water, and so dehydration can always be a contributing factor, but it's more common during pregnancy, right?
Exactly. Blood sugar issues are another one because your insulin resistance is shifting, which is, why we do gestational diabetes testing, which we've talked about. And so maintaining the proper level of blood sugars, that can be very important to help avoid headaches in some people. Okay, so another reason is tension in the body because you have your uterus coming out, which is pulling on your back. Your breasts are actually getting larger, which means they are getting heavier, which pull. And so those neck muscles, the shoulder muscles, backaches, all of that posture can cause a tension headache because the whole weight of your body is really radically shifting. And as we know, tension headaches and the tension of the muscles, I should say, causes a lot of headaches. And then the last one that we have is the increased blood volume that is going through you. So the more blood sometimes that we get going, that can be great, but in some cases it can cause headaches.
Okay, so headaches are part of pregnancy for a lot of women, not everyone. For me, I get them a lot during my first half of pregnancy. After about 20 weeks, it chills out and it's not as big. I think mine are probably hormonal.
Yeah.
But it could be any point in pregnancy, and some women are going to be dealing with this for your entire pregnancy, unfortunately. So let's talk about relief and what to do. Okay, Mom, a quick mom-to-mom moment. I have to tell you this because I wish someone had told me. As you may know, I'm a mama of 8, and my first 3 births were rough. I just thought birth was supposed to be that painful. Nobody ever pulled me aside and said, hey, there's actually a better way. Then with my 4th baby, Heather, the midwife and nurse practitioner here, taught me something completely different, a method I had never seen in any book or video or internet research. And I ended up dilating to 10 centimeters with 0 pain. After 8 babies, I can honestly tell you this method works. Most mamas just never learn these strategies. Even if they want to avoid an epidural, they feel like they will cave once things get intense. That was totally me. I had done so much research, but I never found a real method that made birth actually manageable. And that's why Heather and I started teaching this, because birth does not have to feel like torture. So here's your little insider tip. We put together a totally free class for you. It teaches the most effective technique to reduce contraction pain and gives you a sneak peek of our full 10-step practically pain-free birth method. If there's even a tiny part of you that hopes birth could be easier, click the link below and grab your spot. Seriously, you'll be so glad you did. So let's talk about hydration and electrolytes. This is probably one of the easiest things that often will help because it's often the underlying cause of your headaches. So what do you want to tell us about that?
So with the expanded blood volume, we need more fluids. We get most of our fluids through drinking, of course. And a lot of people think, oh, I drink a lot of water, but it's not just water, it's electrolytes as well. We need the the potassium and the magnesium. Like we need all of that balance. And if you're pregnant in the summer, you might be sweating more because we get very hot when we're pregnant, and that's going to, you're going to lose those electrolytes.
Mm-hmm.
So we definitely need to be focusing on drinking more. If you have pretty bad morning sickness, hyperemesis, as you said, for both of us, drinking water in pregnancy, I had to add lemons to it because straight water made me throw up. And so I really struggled with dehydration because of my all-day morning sickness that I had. And so I found that lemons in my water really helped me. I drank a lot of lemonade. I made my own lemonade, so it didn't have the artificial stuff in it and stuff.
Right.
But really increasing that. And I think part of the hard part of headaches is you have to figure out what caused your headache. So we're going to give you a lot of different suggestions because we don't know what's causing your headache.
Yeah.
So,
and I will say electrolytes, I didn't know about them back in the day. Only recently have I learned about electrolytes. I use Just Ingredients electrolytes because they are clean. They taste fine. I mean, I'm not like, ooh, this is the best drink, I love it so much, but they taste perfectly fine. Whereas some I think taste pretty gross. And they're very well priced. And so that's what I use. I'll just throw a link down for you so that you can do that. They have several flavors that you can try. For me, even now when I'm not pregnant, I struggle with low blood pressure. And so making sure that I have enough electrolytes helps with that. And I wish I had known about this back with my pregnancies. I think it would have helped me a lot. I can tell I get just a regular headache if I get dehydrated, and drinking water will not fix that. But if I'll take electrolytes with water, a lot of times that's all it takes to get rid of a headache for me.
Yes, definitely. And one way you can tell is your urine. If you are peeing and it's very yellow, very orange, it's more concentrated. So it should be just a faint color of yellow, just a very faint color, as long as you don't have B vitamins mixed in there causing that issue. But yeah, you want very light colored because that will say, okay, I'm hydrated, we're doing well here. So water for sure, but don't forget some electrolytes mixed in there, especially if there's been a lot of sweating that day, going to the beach, exercising out and about, that sort of thing.
Okay, the next one is also probably an issue that I had during my pregnancies. I told you that I had this mostly during the beginning part of my pregnancy, so that's why I think hormones had to do with it partly. But I struggled with my blood sugar because I was so sick that I didn't want to eat, or I was eating inconsistently. I was eating a lot of carbs because that's all I could keep down. This is just a really common issue. So we talk about this in depth in some other videos that we do, but we're going to give you a really quick overview of how to keep just a steady, healthy blood sugar levels, generally speaking. Okay, give us a quick
thing. So number one, obviously stay away from sugars, processed sugars, juices, anything like that. But protein is going to give you more of a sustained blood sugar level. So you can put some, not refined, but some complex carbohydrates in there and spread it out. So for instance, an apple is a really good fast treat, but an apple, though it has the fiber and an apple in and of itself is very good, you're going to burn through that really quickly. So adding cheese with an apple, or peanut butter without a lot of sugar added peanut butter to an apple.
Natural peanut butter.
Right. So that is going to help sustain the carbohydrate of the apple, and the protein is going to make it last longer so that your sugars don't go up and then crash.
You avoid your glucose spike.
Exactly. And so take a protein and then combine it with not a lot of carbs, but just a little bit of carbs in there. Or like I said, if you want that apple, please eat the apple with some protein, the cheese or the peanut butter or whatever you find that is good for you, almond butter, so that you can maintain that blood sugar level and it helps to break down. For instance, bread warm, you are going to burn through bread. And so that's why we put butter on bread. I mean, besides the fact that it tastes really good, not margarine.
That's why I put butter.
Not margarine, butter, okay? Because the fat of butter will help slow that down. Warm rice you're going to have a lot more sugars than if you eat that rice cold. And then of course you add a protein to it. That makes all the difference. Eat your proteins first, and then your sugars, or the carbs, I should say, but carbs are sugars, afterwards. Or in the case of an apple, I'm just going to eat, one bite of cheese, one bite of apple, one bite of cheese, one bite of apple, that sort of thing. So those sort of things can really help with it.
You don't have to get too complicated, just protein with carbs. Don't eat carbs alone. And then we talk about this extensively all the time, but you want to be eating throughout the day. Much more important than when you're not pregnant. We're not doing intermittent fasting while we're pregnant, and we're not skipping meals, and it's a pain. I find it to be a huge pain to have to eat so frequently, even if it's just snacks. I just don't like living my life that way. But when you're pregnant, sorry, you have to. It's going to help you with morning sickness, and it's going to help maintain those blood sugar levels so that you can hopefully reduce the amount of headaches that you're getting.
Well, and as your uterus grows, it pushes on your stomach, and you can't have meals.
You can't just have a whole big meal.
There's no room in your stomach. So it's snacking throughout the day. But once again, when we say snacking, we mean healthy, not chips.
Yeah. Okay, another big thing you want to be doing is making sure that you are consuming enough magnesium. You want to talk to us about that?
So magnesium, one of the many things that it does. Now, first off, there are many types of magnesium. There's glycinate, citrate, threonate. Oh my goodness. But just a bunch of different types. So each one has a thing it does best. Okay. So citrate helps us to be able to move our bowels more effectively, and glycinate helps us with muscle relaxation and sleep. And that's why the magnesium works so well.
Okay.
So taking magnesium, and the one that we recommend the most for this is the glycinate. It can help with that muscle relaxation, that tension, and it helps in a lot of the different reasons that you may have headaches, because the muscle relaxation, the sleep, which we're going to talk about, and all of these, getting the toxins out of your body, which is having bowel movements. So all of these sort of things, that's where the magnesium can help. And you need about 300 to 500 milligrams a day. Some people may need a little less. Some people may need even more. Like if you're constipated, you might need more. So, consult with your provider on how much is good. But 300 to 500 is a pretty good number in there.
Okay. So honestly, taking a supplement is just so easy. But of course, a lot of healthy foods that you should probably be eating anyway are also high in magnesium, and it's always good to ensure that you're getting as much of those types of vitamins and minerals in your food sources as well. So we've got nuts and seeds, legumes and beans, avocados are high in magnesium, banana, yogurt, fish. There's a lot of, basically, if you're eating a good amount of healthy foods, you're going to be getting magnesium. If you're eating a lot of processed foods that aren't whole foods, real foods, it's going to be harder to get that from a diet source.
And that's a key. That's why so many people are deficient in magnesium, because it typically comes from fresh foods, not processed foods. So yeah.
Okay, so Heather mentioned tension and how magnesium can help reduce that. Posture and alignment of your spine can also help reduce that. So, for all of these, think, could this be relevant to me, right? Maybe it's not, maybe it is, but if you're having a lot of headaches, you want to troubleshoot and try to figure out, could this be relevant to me? So think about your posture. How often are you in a bad posture? Could your spine be misaligned? I'll tell you, I had neck tension for about a decade. My neck was just always tense. And I used to say, I store all of my stress in my neck. And anytime, if my husband would offer me a massage, I just would say, just my neck. It's the only place I need a massage. Keep it there, my neck. I don't need it on my head, my back, anywhere. It's just my neck was always sore. And then during one of my pregnancies, I had a breech baby. And so I went to the chiropractor for the first time. I'd never had been to a chiropractor before. And he adjusted my whole spine because, of course. And wow, guess what? For a decade, I had this constant tension in my neck because my neck was misaligned. And it took 30 seconds for that to get fixed. So I was really regretting that I had never tried that before. I just had no idea. It's easy for your neck to get misaligned. Like honestly, I got it misaligned one other time from falling asleep with a baby sleeping on me. I was sitting on the couch and I fell asleep and just was in this position for probably a couple of hours. And then I started getting that same tension again. So, but by then I knew, my neck is misaligned. So I just went back real quick, got it fixed, no problem. But that's just a tip for you. Maybe you should try chiropractor if you've never gone, especially, and just make sure that everything is aligned, because all those nerves are going through there, and it pulls the muscles out of place. So your muscles are constantly in a wrong position. Yep. And in a position that's causing tension and pain.
Oh yeah, that can be huge. And sometimes I have one chiropractor, that is what he can do for my headaches. You know, he kind of helps in the other areas, but if I have this tension headache, I go to this one specific chiropractor. Every time he can get rid of my headache. So definitely the tension, the posture, and we have an entire video about our posture and how that affects you in pregnancy. So definitely look up that one
as well. Okay, one more quick tip I'm going to tell you is I took my daughter to a DO, so doctor of osteopathy, and she does musculoskeletal manipulation. So it's kind of like a chiropractor. And my daughter was getting a lot of headaches, and she said that the sutures on her skull were too tight.
Interesting.
And she was able to loosen those, because that way the fluid that is supposed to flow over your brain and down through your spine, and it does that especially when you're sleeping to cleanse and detox your brain, it didn't have a really easy flow.
So she did craniosacral therapy.
Nice. And that was all it took. She had been getting chronic headaches, and that was all it took. So that's not going to be specifically related to pregnancy, but I just want to throw that out there because I'm so happy that we discovered that, and it was such a quick, easy fix. But unless we knew about it, well, we didn't know about it, but we happened to have gone to that doctor and she knew about it. So pro tip, if you are finding that you have a lot of headaches, you can also give that a try.
Sleep is another issue that can really cause headaches in pregnancy. I know for me, so a little bit different from pregnancy, but if I am up a long time at a birth, all night at a birth, I will get headaches. And that it's the oxygenation as well as that fatigue. I also get very nauseous if I'm really, really tired, not pregnant even. Right. So, and it can be hard because you have the insomnia of the second trimester that happens. The third trimester, you have to pee all the time, all night long, and you're very uncomfortable. So making sure that you have a comfortable mattress or get a topper for your mattress, making sure that...
That's a good idea.
Oh yeah, like we sleep with a fan on because that white noise blocks out the cars going by or the rooster next door or whatever the situation is. That can really help. Fresh air can really help your sleep, not sleeping in a stuffy environment. If you're able to sleep with your windows open, if that's safe for you, if the weather is right outside, that can help. And so finding the things to get better sleep in pregnancy, because we have so many obstacles, some of which I just named, can really, really help. And finding out, what you can do for that. We have a hyperbaric chamber. And I know for the other midwife, just for an example, she had a really bad headache because we had been doing back-to-back births. And she said, I'm going to go upstairs and take a nap. And I said, go sleep in the hyperbaric chamber. This mom isn't going to deliver for a while. I'll watch her. And she was like, no, I'm just going to go nap. I was like, go in the hyperbaric chamber. And the reason is because it will really hyper oxygenate your cells. So I set a timer for an hour. I put her in the chamber and she came out and she said, this is amazing. My headache is gone. Like I just figured this would take it down from a migraine, but it is gone. And it's because of that oxygenation. So like we talked about in other videos, make sure you are breathing deeply. Make sure you are breathing good oxygen as well. Not really related to pregnancy, but related to life, is a lot of people, when there is carbon monoxide poisoning, they get tired, but they get a headache because your body is lacking that oxygen. So try your best to get good, healthy oxygen as much as you can, breathing nice and deep from all 5 lobes of your lungs, 2 oxygenation, sorry, and that will help you get better sleep. So if you have sleep apnea, which goodness, pregnancy, I'm sure it causes so many sleep apnea that we don't realize because baby is just shoved into our lungs. So you may need to adjust the position of sleeping. I know women that have slept in like their recliners. I had a bed that you could tilt up a little bit, and that really helped my breathing. So you have to find out, how is your sleep quality? Are you breathing? Are you having apneic episodes? Are you snoring? That is a sign. And so resolving those issues through little things like pillow wedges and those things can really help with your sleep.
And walking, I know we say that all the time, but honestly, that gets the oxygen flowing through your body. Yes. Well, the blood, and which carries oxygen through your body. Exactly. It just improves your circulation. Like that's why basically one of the main reasons it helps you to sleep better. Another big thing is temperature, because when you're pregnant, you will get hot easier. And when you're hot, you cannot get into a deep sleep as well. Yes. So that's really important to watch the temperature of your room.
The other thing is what carries oxygen into our body. It's our hemoglobin. And it's our ferritin levels. So have your provider, even if it's the end of your pregnancy, but definitely the beginning, check your iron levels, not just the CBC that we've talked about in other videos, with blood work, not just the hematocrit and hemoglobin, but have them test your ferritin. Because if you you can breathe in the oxygen, but if your body can't utilize that oxygen because you're so low in ferritin, your hematocrit and your hemoglobin are low, you're going to get headaches because you're breathing this all in and your body just says, that's really sweet, you're breathing it in, I can't grab it. So
thanks, but
right. So you want to make sure that your body can use that oxygen that you're breathing in as well.
And I just want to point out, these things that we're talking about, we're specifically focusing on reducing headaches, but really everything that we're saying can help your whole pregnancy be healthier, help your baby develop healthier, help your birth go smoother. So it might seem a little overwhelming, but all of these things combined can help you overall be so much healthier and more comfortable and happier. So it's worth paying attention to.
And they all tie in together. Yeah.
All right. Generally speaking, we recommend no caffeine during pregnancy, which very few people actually do, but that is what's best for your developing baby. However, can caffeine help with headaches?
Yes, caffeine definitely can help. If you look at Excedrin, for instance, it has some caffeine in it. And it's there for a reason, because caffeine in some cases can really relieve headaches. And you want to limit it in pregnancy. This should, we really don't recommend your daily dose of caffeine because it does go to baby.
And you can't take Excedrin.
Yes, don't take it. Don't take it.
Just want to point that out.
Yes. But caffeine can help. So, we talked about Tylenol, acetaminophen, why it should be avoided in pregnancy. And that's what used to be recommended, and some providers still do recommend. We don't recommend it more than, if you need to have a dose in extreme circumstances. But caffeine. So a lot of people like to drink coffee. I like to stay away from espressos, cappuccinos. Those have a much, much higher level of caffeine than coffee. And personally, I don't drink coffee because I don't like the taste, but that's neither here nor there. But looking at the caffeinated drinks. So, some people do Coke or Dr. Pepper, whatever, caffeinated beverage.
Source of caffeine.
I would recommend staying away from energy drinks. The absolute maximum that you should have in a day of caffeine is 200 milligrams. And that's not in one sitting, that's throughout the day. And guys, this is extreme. Please do not hit 180 milligrams of caffeine every single day. Like, we just do not recommend that. But if you have that raging headache, that caffeine may really help. And then it's up to you, like we said, caffeine, stay away from energy drinks. So they have so much other stuff in them. So, this is a hard one. The thing
it's
about,
like, if you have to take it because the headaches can get, we understand.
Right.
But
A lot of people will do coffee, for instance, because it doesn't have the high fructose corn syrup in it. It doesn't have the caramel coloring. It doesn't have all the other stuff. So we're not telling you what type of caffeine to take. That is up to you. But look at the additives in a lot of the drinks that are out there that have caffeine, because that can be an issue on a whole other scale. But look, the caffeine really can help with headaches.
It helps me with headaches.
Yeah. And it's not really meant for aches and pains like in your toe or your foot. It's more focused on headaches for the caffeine.
Okay. All right. Now we want to talk about when you should be concerned, because there's a difference between a headache that is just really making your life miserable and a headache that could be a sign of something really serious.
Right. So one thing that I ask my moms when they call and they say, I have a headache, of course, I'm going to say, okay, how many weeks are you? Because that's, going to give me an idea. Is this a blood sugar issue? Is this a hormone issue? You're going to have more common in the beginning of pregnancy compared to the end for those. But once a woman hits about 28 weeks, but especially near the end of pregnancy, I want to know, are you seeing spots and stars? Do you have blurred vision? Not blurred vision your whole pregnancy because your eyes change, but all of a sudden onset of blurred vision. Is this a headache that you've tried many things and you cannot get rid of this headache? What are the other signs? Do you have a swelling in your face, swelling in your hands or feet that has just come on? Or has the swelling gotten worse just come on? Because there are some women that have a little bit of swelling in their feet, especially like in the evening.
And it sticks around.
Right, yeah. And it sticks around. But is this all of a sudden, hey, I woke up with a swollen face. I woke up with swollen fingers. This is a new thing for me. The spots and stars are so important to have, because all of these things can indicate preeclampsia. And that is a medical emergency. It's not a call the ambulance medical emergency. It's you need to get into your doctor's office ASAP. And if you can't, because it's Friday at 5 p.m., it is a visit to labor and delivery. And I say labor and delivery, not the emergency room, because let me tell you what's going to happen. You're going to go to the emergency room and they're going to say, you're 34 weeks pregnant, go straight to labor and delivery. They won't even check you in. And if they do check you in, then they'll going to charge you for it. And then they'll send you to labor and delivery. Yep. They won't touch a pregnant woman in the ER unless it's something like, I twisted my ankle. So do not wait till Monday. If you're having spots and stars and all of these issues, just go. If you have a blood pressure cuff, take your blood pressure. If you have high blood pressure, go straight to labor and delivery.
You could go over to a pharmacy and they have them there usually.
And they're so cheap now. Yeah, it's so cheap. You can go to the pharmacy and buy one for $45.
Oh.
I don't like the wrist ones, just a heads up. The wrist ones, you do have to hold it. You do have to hold up by your heart, but they're just not very accurate.
Okay.
They're not, like, we used to use them in our office until research came out saying that it's so hit or miss with them. Stop using them. But the automatic ones are like $45 at the drugstore, kind of thing. So I really recommend getting that, but it's just not something you can wait on. It's not worth the risk.
Okay.
Yeah.
So that's the most serious thing we're thinking about headaches. Another common problem with headaches, though, is that you can become severely dehydrated. I know that during my pregnancy headaches or their migraines, I just can't keep anything down, which includes water. And so if it lasts for more than, 12, 24 hours, I can really quickly get dehydrated to a point where it's dangerous. And so I've had to go in to get an IV. That is really good because it helps the headache. It helps it go away. But also dehydration is a life-threatening emergency if it becomes serious. And when you're pregnant and you can't keep water down, it's going to get serious much faster than if you're not pregnant. So you do need to take that seriously if you keep throwing up and you're not being able to drink water. And also keep drinking water even though you keep throwing it up.
Yeah.
But if you keep throwing it up and you're starting to feel weaker and this is just getting worse and I'm going downhill, you're going to need to go in and get an IV.
One good thing to do is, and this is why in the hospital they give ice chips, because if you slowly suck on ice chips, you're less prone to throw it up than just chugging water. So little tiny sips or ice chips, or take the electrolytes, freeze them, crush them up, and eat the electrolyte ice chips. You're much, much, much less likely to throw that up, like I said, than drinking gulps at a time. So little tiny sips or ice chips work, or sucking on an ice cube. Popsicles. I tell people, try not to get the popsicles with red dye 40 and all of that, get the more organic juice popsicles, but that can really help. The other thing with the headache is if a headache comes on very quickly and you think to yourself, this is the worst headache I ever had. Those are two big warning signs. A headache that comes on in minutes, it just boom, hits you, and a headache that you're like, this is insane. I have never had a headache this bad. Those are huge warning signs as well.
Okay.
We're compared to the one that has just kind of slowly grown. And I'm more worried about a headache with high blood pressure than just a headache, a regular headache by itself.
So that's a situation where you're not going to be trying, let me do some natural remedies and see if this can help calm down my headache. You need to take that seriously and be taking action really quickly.
Exactly.
So just to wrap everything up that we've been talking about, most headaches during pregnancy are going to be either hormonal related, which you really can't do much about that except just try to treat the headache itself, or lack of hydration, blood sugar issues, or tension issues with the muscles in your neck and head. So try the things that we've said. Hopefully they can help you reduce your headaches, like the frequency of your headaches, and also reduce the severity, and also in many cases get rid of them. Relax, take a cool bath. Those things we didn't even touch on. I think that everybody knows, things like that can help with a headache. And just want to let you know that if you are pregnant, we have a free birth class called How to Give Birth with Practically No Pain. That is a really effective way to reduce pain during birth, and we take a very holistic approach of a lot of different things you can do, because the whole entire body, spirit, mind is all involved in birth, and there's a lot of multifaceted things you can do to reduce the pain and have a healthier, safer birth. And so if you want to learn about that, be sure to check that out.